Welcome back. Late last night, the FDA authorized a COVID-19 booster shot for those with a weakened immune system. It's going to affect several million Americans, and it comes as President Biden cheered on local political leaders who are defying governors, Republican governors, mostly in the South, who are banning mask mandates.
To the mayors, school superintendents, educators, local leaders who are standing up to the governors politicizing mask protection for our kids, thank you. Thank you as well. Thank God that we have heroes like you. And I stand with you all, and America should as well.
Yeah, there's a lot of heroes out there who should be saluted. Joining us now to talk about all of this is, I think you're a hero, Dr. Bernard Ashby, friend of the show too, because you're on the front lines in a lot of ways. Cardiologist you are, and the Florida State leader of the Committee to Protect Health Care. You've been outspoken, Dr. Ashby, throughout the entire pandemic, and I don't suspect it's going to change this morning because I've been on social media. But, you responded to the booster shot news by tweeting in part, "We don't care about variants when almost 99% of people in low-income countries haven't received one shot yet." Explain your outrage. I think that's a fair word, right? That you were outraged by this. Why?
Good morning, Sharon. And yes, I have been outspoken. So, I would like to preface this by saying that it is important for physicians and other healthcare professionals to have more flexibility with determining how many doses of the vaccine to give, and whether or not giving a third dose in certain individuals is appropriate. I think that flexibility is important. There was actually a recent study that showed that quantitative antibody response was directly correlated to vaccine effectiveness in the real world. So that's an important point. And Dr. Kizzmekia Corbett actually did these studies in primates prior to the vaccine becoming available, and also showed that your antibody response was indicative of how the vaccine response would be short-term and long-term. So that's an important point. However, there's been a constant messaging about get your vaccine because we're concerned about variants. Well, there's two things about that. Well, one is if we gave everybody that's been currently vaccinated a booster, that will do little to curb the pandemic, at least as it pertains to the U.S. In terms of, what our most potent strategy would be. And two, America only counts for less than 5% of the world's population. Last I heard, there were 7 billion plus other people out there who also would benefit from the vaccine. And if we look at low-income countries, nearly 99% of those countries haven't even gotten one dose of either vaccine. So clearly that variant argument doesn't hold a lot of weight. And, the fact that countries like the U.S. and other wealthy countries are hoarding the vaccines, and these other countries are left out to dry, to me is very concerning because one, obviously those people need to be protected as well. Two, variants have a large pool of people to, thrive in, and we're really not addressing that whatsoever. And it's kind of hard for me to reconcile the variant message here in the U.S. with the rest of the world not getting their vaccine. So that to me seems pretty messed up.
Yeah, well, you said a lot there, and it makes sense, right? People forget that this is a global society that we're living in, right? It's just not America, even though we tend to have a me first attitude. But what about the argument, people pushing back against your statement saying, look, Dr. Ashby, there's vials out there that are going to expire. There's vials that are going to go down the drain. And even though there's some people who I tend to think are a little bit knuckleheaded and just won't get the vaccines no matter what about other people who say, I want to be extra protected? Why can't I have those vials that are going down the drain soon?
Well, like I said, there's nearly 99% of people in low-income countries are begging for the vaccine. They would love to take those off our hands. So that's an important point. And as for people who are still unvaccinated, I mean, they've pretty much made a decision. Specifically if we're focused on African Americans, we've always had traditionally lower vaccination rates, and there's
Yeah.
a good amount of people who are waiting for the FDA to approve the vaccine. Although anyone who studies the way the FDA approves medications and the particularly the FDA authorized vaccines, we know that approval is imminent. It's pretty clear at this point, and the FDA needs to go ahead and wrap that up and give that approval
Yeah.
so that subsegment of people who haven't gotten vaccinated will then go ahead and get vaccinated. However, when we're talking about the other subsegment of the population, particularly Black Americans, it's interesting that we're telling them to get vaccinated, that we're promoting vaccines over and over again, yet we didn't care about them before, and all of a sudden we care about Black folks now. Heart disease killed more people last year than the pandemic did in the U.S., and yet we're not addressing heart disease. We're not addressing cancer. We're not addressing the pitiful life expectancy of Black males and Black women in our country. And so I think if we really cared and wanted to get these vaccination numbers up, we would put our money and our resources where our mouth is and address these long lasting issues that preceded the pandemic and will continue to be there after the pandemic. So, I think we need to have a reckoning with our institutions and our healthcare system because, frankly, Black folks are calling out the BS.
And you are leading the charge, and there's a lot of people behind you, Dr. Ashby. And I want to ask more about what that looks like. If you could tell us, putting our money where our mouth is and addressing these longstanding issues. And I also want to know about Florida being a hotspot for COVID and how you are seeing, observing Black and brown people in your community, how they've been impacted by COVID-19.
So, in terms of addressing these longstanding issues, I mean, how about we start by providing healthcare? Okay, healthcare is a right; it's not a privilege. And the fact that we're the wealthiest country in the world, and yet so many Americans, particularly people of color, Indigenous Americans, Hispanic Americans, and Black Americans, do not have healthcare or are underinsured is ridiculous. And so let's start there. Let's provide health care to these individuals. Florida, in particular, after the Affordable Care Act was passed, declined to participate in Medicaid, which would have potentially given thousands of Floridians health care. And, now they want people to get the vaccine. I mean, come on. And
Yeah.
speaking of Florida, Florida is just ridiculous. Our governor,
Hmm.
Ron DeSantis is just playing politics all over the place. He clearly doesn't give
Might be better if his
two
name was
craps
Marcus.
about. Well, yeah,
Sorry, Dr.
he clearly
Ashby.
doesn't give two craps about Americans, Floridians' health. I mean, the way he's talking about vaccine, doesn't care about the children, and is just finding every opportunity to talk about how he wants freedom to not wear a mask, which is ridiculous given the fact that we know one of the our most fundamental mitigation tools for decreasing the spread of the virus, particularly with the Delta variant having such a viral load, are masks. And he's basically, a de facto anti-mask person. And Marco Rubio just
Yeah,
came out and said that masks don't work, which is obviously ridiculous. And these folks are
this guy.
operating very recklessly.
Yeah, they are. I would say I would love, since you're all in the same state, to set up something where you could talk to Marco Rubio and Governor DeSantis, but I just don't think that would go very well. Real quick, because we're almost out of
Mhm.
time. I know you have tips.
Mhm.
My child is not yet 10, cannot get the vaccine. Give us the tips if you can, because right now vaccines aren't available for them. But you say there's ways to get through this. Protect your children. And the
Mhm.
verse was vaccinate your child ASAP, right? If you can. But also, you went further on your Twitter account. I'm looking at get immunity status of teachers, staff, review local school district policies. And then there was this one I want you to speak just a few seconds about. Send child to school with CDC approved mask, because we got all
Mhm.
kinds of masks from Amazon and all other places. But you want us to be clear.
Yeah. So the CDC basically recommends if you do cloth masks to have two or more layers in that mask. Make sure that it fits your face. Make sure that you have a
Mm.
nose piece that fits right around your nose. However, schools should be providing disposable masks at the schools. I mean, those are
Yeah.
almost certainly effective, and you don't have to worry about those getting dirty. And kids, some kids, a lot of them don't wash their masks, so that would be a great measure to equip the schools with disposable masks so that these students can use them. And then also, the CDC says it recommends against N95 because they're worried about the supply. Well, supply is not an issue. We have plenty of N95 masks, plenty of KN95
Mm-hmm.
masks. And so if you are
Mm-hmm.
concerned about your child, uh, give them a N95 or KN95 mask to go to school with, and let them protect themselves, because in states like Florida, where masks aren't mandated, uh, your child is still at risk with the normal mask, and N95 will go a great deal to protect them as individuals and protect other folks. But again, the politics around masking is ridiculous, and there are going to be classes taught about just about how reckless our leaders were during the course of this pandemic, and how that directly
I
led
think
to
you're right.
unnecessary deaths and harm.
I, I think you're absolutely right. I think it's criminal, and hopefully there'll be some changes down there in Florida. It sounds like it's not going to change until some people change out. Dr. Bernard Ashby, you are a friend of the show, and we appreciate your candor, your in-your-face medical talk, your excellence. Thank you so much for starting your day with us. And I'm going to keep following you on social media because I love it when you go bold. Keep going bold, Dr. Ashby. We're right back.